I'm Dr. Mike Milligan. I'm here with Tony Soileau, Dr. Tony Soileau from Lafayette, Louisiana. Tony, thanks so much for joining us.
Thank you.
Great. Now, we've got another video on the site about Tony with sleep apnea, but today he's also an expert in cosmetics and veneers. In fact, I've heard Tony speak in Peoria, Illinois, on veneers recently. So, Tony, if you could tell us a little bit about cosmetics and veneers, just some of your thoughts on this, and then we'll see where this goes.
You know, veneers are an absolutely wonderful way of working with our patients. You know, a lot of people would love to have a beautiful smile, but they simply do not want braces.
Yeah, sure.
So what happens is there's nothing wrong with braces. That's a great option, but what if they don't need it? Well, veneers have progressed through a certain amount. It used to be it was, well, simply composite. That was kind of your one option, and there are pros and cons to that. Then there were veneers and pros and cons to that. You know, and one thing about veneers is if someone's got a smile and it's not just right, but it's close, you really hate to shave those teeth back.
Yeah.
You really, because now it's something you've done permanent.
Right.
Well, the nice thing about with porcelain veneers is they now have these very thin veneers you can make. Now they're 0.3 millimeters.
Yeah.
And it was just at one point it was just lumineers, but now a lot of labs can make these, especially using a material called EMAX,
The new EMAX, right.
which is a lithium disilicate. We're actually making these things ourselves. We have a CAD/CAM system in my office. We use the E4D system, similar to the CEREC, just sold by Shine, the CEREC sold by Patterson.
Right.
And we're milling these things down to 0.3 of a millimeter,
Okay.
which is so thin you can put them just on top of the tooth and it still looks absolutely beautiful.
Yeah.
So now we don't shave back teeth anymore when we do veneers unless the tooth is sticking out in the first place.
Is
in which
that
case,
right?
that's
So
the only reason. We don't shave them
okay.
back anymore. So there's no anesthetic. It's a simple procedure.
Now, this is one of the experts here, folks.
So there's basically two types we go with. Is it going to be composite or is it going to be porcelain? I think you need to be phenomenal at both. And there are some great courses to teach you how to do these. Okay. Learn how to do both. Don't be one afraid of composite veneers.
Right.
They're not going to last as long. That's true. And we're up front with the patient.
Right.
It's only going to look good for about 7 years. In 7 years, you're going to want to redo these. Start to discolor. They soak up stain. They chip, that sort of thing. But you can charge a much lower fee, and it's a much lower expectation.
Right.
But it's a nice way of walking the patient into it.
Right.
Something simple and easy to do. For a lot of these veneer cases, you got to remember, from the patient's point of view, they've got an event planned that they want this for. They didn't just wake up one morning and say, you know what, I just want a new smile. That's very few. They have a date in mind they want a new smile for.
Interesting. Okay.
And what if it's a wedding and their daughter or their son's getting married? They're already spending a lot of money. They may not be able to do porcelain veneers, not right now, but we can do them out of composite, and it'll look great for more than enough time to get them through the wedding, and it'll look fantastic. The patient will be more than happy.
Yeah.
As a dentist, you may say, well, wait, I could do so much better job of porcelain, but the patient may say, yeah, I don't need that.
Right.
Not right now.
Right.
They can always come back later, and 5, 7, 10 years later, you just let the patient know, okay, it's time to upgrade. Do you want to just redo the composite? Nothing wrong with that. Or do you want to move to the porcelain? And there's nothing wrong with that.
Yeah.
A lot of dentists would do composite because they just didn't want to shave those teeth back.
Right.
That's understandable. A lot of dentists would just do porcelain because they just didn't want to have to learn or take the time to do the composite.
Yeah.
But if you take the time to learn to do both,
And it's not that hard.
it's just not hard.
Yeah.
Okay, and now with these veneers where we just are not prepping teeth anymore, there's no temporaries, there's no anesthetic, there's no worry about soreness. There's no worry about tenderness. I mean, it's just so easy to make these things.
Okay. So what do you just feather these at the
Just
incisal edge?
feather them at the incisal edge. You used to have to
prep the
take
top
off, right. You take off 1 millimeter to 1.5 millimeters, and 2 millimeters was even best, so that you could create all this nice incisal edge.
Right.
And you hated doing that. Well, now you don't have to do that anymore. You just simply layer it right on top of the tooth. And I avoid the incisal edge if I can. Okay, the only time I'll take off the incisal edge, if they've got some little chips in there, some little cracks.
Yeah.
I don't want one of those little chips or cracks to propagate down, break the seal of the cement. Now I'm running into problems.
Right.
So if they've got a nice smooth incisal edge, I leave it alone. Usually what I do is I actually prep the incisal edge with a flexi disc. I take a coarse disc and just smooth it.
Okay.
And that's my prep on the incisal edge.
How far?
If I can help it, just get it smooth.
Just down to where it's
Just
smooth?
down to where it's smooth, and I just put the veneer right up to the edge, not over the top of it.
Now, what percent would you say are Emax now?
In my office, we're doing just about every one of them out of Emax.
Okay. That's
And
100%.
it's all 100%.
Okay.
And now the reason for this simple, Emax is so very strong. Now, Emax, when it first came out, the problem was this was a posterior porcelain. It was very hard, but wasn't very lifelike. So for a lot of dentists, when they hear Emax, they're going to think, Inceram, something that's very hard, but it's very opaque, it's very dull looking, nothing you put on the front. But Ivoclar came out with their new high translucent Emax.
Okay, so that's
This stuff is, it's incredibly clear, it's incredibly lifelike, and it lets that natural tooth shine through.
great.
So pretty much every Emax case I do now, the actual Emax is shade B1. Almost every one.
Almost every case?
Every case. However, for the people that want very white teeth, they want whiter than B1, we just use a very opaque cement. So the cement becomes my dentin layer, and that very clear Emax becomes my enamel layer. So I've got very white with a very clear layer on top, so you get that translucent of light. It makes for a very beautiful, lifelike looking tooth.
What cement kit are you using, or do you use a number of them?
There's a number of them, and I've used most of them on the market. I won't say I've used all of them. Variolink 2 from Ivoclar. It's a great cement, a lot of great shades, very stable, very easy to work with. Rely-X veneer, it's a wonderful cement. There's Moho veneer, this is from Pentron. Great cement, very few people know about it. It's a phenomenal cement, not very expensive, and it's probably the clearest cement on the market. The nice thing about cements now is they're making them so easy to clean up. The problems with veneers, you have to basically cure these things on all the way, then clean them up. Well, you got a mess. You basically cemented 8 teeth together.
That's right. Yeah.
Well, now they've got these cements where they go through a gel stage. So you lightly cure it, low power, light cure it for about 3 seconds. The veneers are essentially tacked on. Now they're not fully on, but they're tacked on enough to where you can just get a scalpel, 12B, and just clean that out. Not completely, don't go nuts with it, but just start cleaning that stuff out. Now fully cure them. But now you've cleaned off 80% of the cement. Now it's easy to go through, break through the contacts, get all that cleaned up. You don't tear up the tissue like you used to. So the cements now have that gel stage. It's not the way it was 10 years ago, even 5 years ago. Okay, so cementing is now easy to do. It's not a chore. Absolutely.
So one of those kits to cement with, and then the Emax for the veneer. Let's see, did we talk about how we get more information on this?
Yeah, there's simple ways. That the best one is just go to one. There are some courses that are teaching this. Dennis Wells in Nashville, Tennessee, Dr. Dennis Wells. If you just Google that, Dennis Wells, W-E-L-L-S, teaches a fantastic course on these no prep veneers. And really, the prep is so simple. It's just kind of now needing to know when do you prep, when do you not. And usually the issue is when I talk with dentists is I'll have cases where I prepped a little bit and I didn't have to. And that's usually where the dentists struggle. It's not, they'll know when they need to prep. If a tooth's sticking out, you know you got to shave it back. It's usually the case where you're going to go leave dentist's office and say, you know what, I prep more than I need to. And it just makes it nice. We're just not shaving back these natural, beautiful teeth. They're just a little too yellow or a little too rotated, and the patient doesn't want braces.
Fantastic. Okay, so Dennis Wells on that. If they've got some questions for you, how do we get in touch with you?
Again, easy to get in touch with me. Smiles by Soileau, and my name is spelled S-O-I-L-E-A-U. Smilesbyswallow.com. Just go to my website. All the cases on there are my cases, my photos, my patients, and they're all my veneers.
Fantastic.
So go to my website, but feel free, shoot me an email. I answer emails every day from dentists. That's something that we're comfortable doing. It's not a chore for us. I'd love to hear from any of your viewers.
All right. Tony, thank you so much.
You're very welcome. Thank you. Appreciate it.